Parent and Mental Health Talk Kit. Welcome! Today this video is presented by Marilyn Rhoda and will cover children's mental health. This information was created by the Center for Disease Control and U.S. Department of Health and Human Services. What exactly are childhood mental health disorders? Mental disorders among children are described as serious changes in the way children typically learn or handle their emotions, which cause distress and problems getting through the day. It is normal for children to have fears and worries from time to time, but persistent fear that affects their day-to-day life may be a sign of mental health disorder. Common examples of mental health disorders are attention deficit hyperactivity disorder, known as ADHD, anxiety, and behavior disorders. Data and statistics on mental health for U.S. children. ADHD, behavior problems, anxiety, and depression are the most commonly diagnosed mental disorders in children. Depression and anxiety have increased over time. Rates of mental disorders change with age. Diagnosis of depression and anxiety are more common with increased age. Now we will go over 10 common warning signs to be vigilant about in your children. Feeling very sad or withdrawn for more than 2 weeks. Seriously trying to harm or kill him or herself, or making plans to do so. Experiencing sudden overwhelming fear for no reason, sometimes with a racing heart or fast breathing. Getting in many fights or wanting to hurt others. Showing severe out of control behavior that can hurt oneself or others. Not eating, throwing up, or using laxatives to make him or herself lose weight. Having intense worries or fears that get in the way of daily activities. Experiencing extreme difficulty controlling behavior. Putting himself or herself in physical danger or causing problems in school, using drugs or alcohol repeatedly, having severe mood swings that cause problems in relationships, showing drastic changes in behavior or personality. If you notice any of these warning signs, it is important to start a conversation with your child. These are some questions that you can lead with. Can you tell me more about what is happening, how you are feeling? Have you had these feelings like these in the past? Sometimes you need to talk to an adult about your feelings. I'm here to listen. How can I help you feel better? I'm worried about your safety. Can you tell me if you have thoughts about harming yourself or others? Remember these tips when communicating with your child. Communicate in a straightforward manner. Speak at a level that is appropriate to a child or an adolescent's age and development level. Discuss the topic when your child feels safe and comfortable. Watch for reactions during the discussion, and slow down or back up if your child becomes confused or looks upset. Now we will go over action steps for parents if you are concerned about your child's behavior. Talk to your child's doctor, school nurse, or another healthcare provider and seek further information about the behaviors or symptoms that you worry about. Ask your child's primary care physician if your child needs further evaluation by a specialist with experience in child behavioral problems. Ask if your child's specialist is experienced in treating the problems you are observing. Talk to your medical provider about any medication and treatment plans. Seek immediate assistance if you think your child is in danger of harming themselves or others. You can call a crisis line on the National Suicide Prevention Line at 1-800-273-TALK. If your child is in need of community mental health services, you can find help in your area at www.mentalhealth.gov/gethelp/immediate help. Thank you for listening.